Hey, everybody, Rolonda on Demand coming up. And the lady right here is changing and saving lives. We're going to find out how right now.
It's road time.
Welcome to Rolonda on Demand.
I love my podcast because we not only tackle the tough issues of the day, but we deal with hot topics, celebrity interviews, and information that can help you in your business or relationships.
This is Rolonda on Demand.
I am so proud of you. You know, I look at your headshot and you look like sunshine. I mean, you just beaming. You know, there's nothing like a woman in her element. And you are clearly in your element. Your confidence shines and it's so attractive. Let me tell everybody who Roslyn Daniels is. Roslyn Daniels is president and founder of Black Health Matters, the leading health promotion and disease management online platform serving the needs of consumers, patients, and physicians. She is a tireless advocate, and I've seen her in action, so I know for sure. She wants to eliminate health disparities. She wants to improve the health literacy of African Americans, not only consumers, but patients as well. She's a former executive in broadcast and publishing and is a nationally respected health strategist. Well, I didn't even know there was a health strategist. And you've been doing that for 2 decades. My goodness. But this is all about cross-cultural health education, programs, and initiative to help save lives. And let's face it, folks, the African-American community was very hard hit during COVID, and that wasn't really new to us because we know we have major health problems. When you have situations like African-American men having the lowest life expectancy and the highest death rate compared to men and women in other racial and ethnic groups in the United States, well, that's something worth talking about. And that's what we're going to do. Roslyn Daniels, welcome to Rolonda on Demand. And I am so excited about this weekend, the upcoming Black Health Matters Summit. Welcome.
Thank you. Thank you. I appreciate that. We are going to have a great day. It's going to be, like I said, fellowship, community, communication, and commitment.
I love it. I love it. Well, I was part of the first one and I've seen it in action, and I'm just going to tell everybody this weekend, set the time aside, get thee to your computer, your phone, your iPad, whatever, and just listen, do your work or clean your kitchen or mop the floor and just listen to these brilliant minds and learn something. Take notes. I always say note takers are money makers. So take some notes. It can save your life, some of this information.
So we actually launched Black Health Matters in 2012. And the impetus for it was the Affordable Care Act. So understanding that our president, Barack Obama, was really interested in health equity, right? Like you said, you can't have happiness, you can't have joy unless you're healthy. And so because of the ACA, we understood it was an important milestone in the nation's history. And if you've had a grandparent, an aunt, and uncle who died too soon, and you're like, what happened? In a story, in terms of like when they go to the hospital, instead of getting better, they're getting worse. It's because their disease was so advanced. What's the expression? You take an Advil until you have to go to the emergency room. So there were so many cases of that. So with ACA, at least you could get an appointment with a physician as a part of your regular overall health strategy, like 2 appointments a year, you're entitled to that. 2 cleanings of your teeth a year, you're entitled to that. So we felt that all of that is good, access is great, but unless you have an understanding of what the fundamentals of health are, it doesn't matter if you have access. If you're not hydrating, right? If you're not exercising, it doesn't matter. And so we built Black Health Matters to be that bridge or the North Star for thousands of African Americans who would start to embark on a new health journey.
You have some of the top people in the medical field, it's TEDx type speakers. You have celebrities who are coming in and joining force. And, that's pretty significant because celebrities don't always talk about illness, whether that's fear of work or just exposing themselves or being too vulnerable to their fans. we also are dealing with a community that's afraid sometimes of doctors and hospitals. You've got a lot on your hand. I would think that the summit and the familiar faces and the types of caliber of intelligence you're getting in there to talk about medicine is really making a huge difference as well.
It is. It is. So, originally, so I'm fortunate in that I get to go to all kinds of conferences. I get to go to the National Medical Association or the Black Nurses Association. And when you see a lot of these scientists take the mic and talk about a molecule or an advance for cancer, there's a look on their face. They are in nirvana. And I said, you know what? If I could just capture that magic and share it with African Americans as a community, we would have something important. And, people were like, well, are Black folks really going to sit through a full day of clinical presentations on health and wellness?
Are they? Did they?
Yes, they did.
I witnessed it. We learned so much in a comfortable atmosphere where people weren't talking medicalese. They were breaking it down where we could get it and waking us up on a lot of things. I mean, talking about hypertension, diabetes, heart failure, breast cancer.
We have to thank you for your advocacy, Rolonda, because like you said, a lot of celebrities might not come forward. We've been doing this for a minute, and a couple of years ago we couldn't get arrested, right? if we were to walk into William Morris or what have you. And now, because of people like you stepping forward, your interview with Lisa Morgan was fantastic, talking woman to woman about what it's like to have heart disease, as you interviewed her to talk to her about her symptoms and what it meant to her career, how she had to modify her schedule, all of that. And so now we're kind of seeing the halo effect in that more and more African-American celebrities want to have purpose. And why not talk about health?
And especially if it helps our community. Absolutely. It was interesting because when I was talking with Melissa, I got to be a little vulnerable myself and tell about a bout I had over the holidays, and hypertension was part of that. I had a really bad stomach flu and dehydrated myself and didn't realize dehydration is a direct link to hypertension. And that hypertension is that silent killer. You don't know, there are no big symptoms. So it really encouraged me to say it's okay to talk about something. You're in a safe environment. And also the importance of just the checkups. Just like you said, if we aren't going to get the preliminary checkups, then we can't stop it before it gets too late. And maybe that only adds to our fear. Oh, if you go to the hospital, you're not going to come out. Well, if you don't wait till the last minute, you might not. So there's some things that we can do to stop our fear, as well. As I always say, when you're prepared, you're no longer scared. And that education is preparation.
Absolutely. So yes, as you said, you've got to be able to speak it and walk it and call it into existence. And by you sharing, that opened the door, because people feel like, well, they're a celebrity. They have a lifestyle. They're happy. They make X amount of money. What's that mean? Black doctors die at a higher rate and are sicker than their white counterparts. What does that tell you? It doesn't matter if you have a PhD or MD, you still are more vulnerable to disease based on a variety of constructs that just make it so much more difficult for African Americans to get the best healthcare possible. During COVID, there was a Black female doctor who chronicled her demise in a hospital.
Right. That's right.
He would not give her the tests, the treatments that she needed. She's like, I am dying and I'm going to film this. True to her conviction, she did not make it. What did we learn from that? So, there's still so much to tell. There's just so much involved in it. And through our summits and speaking with like-minded people, and also bringing new people into the fold, because we feel that it is a movement that we're making a difference.
Absolutely. These statistics just blow me away. African American men have the lowest life expectancy and the highest death rate compared to men and women in other racial and ethnic groups in the United States. That's just amazing. That's just so sad. And that's why we have to talk about this type of thing. I really like, and I'm a Noop's daughter. You know, my daddy was a proud Kappa.
All right.
And he ran the Kappas down there at Winston-Salem State University. But I love how you are partnering even with African-American fraternities to help address this problem among Black men. We got to hit it from every angle. We got to hit it from the frats, the sorors. We got to hit it from the churches, the schools, the HBCUs, the celebrities, all of it, whatever we have to get the word out.
It makes a difference. So, you know, for example, so I'm a woman of a certain age, right?
I know that we might have played in the same sandbox.
So no, but well, that's another conversation. But anyway, yes, I used to babysit you. Anyway, you know, I would look around and be like, I'm ready to date. I'm fine. I'm fit. I'm ready to mingle. I've been looking around, looking at the Black fellas and be like, well, what's wrong with him? Oh, he's got high blood pressure. This one can't run. This one's too fat. I mean, I'm not trying to criticize, but you know, you want to be, if I want to hike, I want somebody who can hike with me, right?
Right. They start looking like kangaroos after a certain age with a pouch, Roslyn. I mean, let's face it. And listen, and all those pills for your health and all that hypertension and not exercising, smoking and drinking, it affects a lot of things.
It does. It does. So here I am trying to date someone with equal energy, and it's like, well, nobody's around. So with, like you said, I read through the stats. Black men are some of the most medically underserved in this country. So what are we going to do about it? It's Black Health Matters that went to Kappa, and they were so receptive and said, let's set up and do a summit there. We've got to break the cycle. Black men modeling health behaviors for other Black men is the only way to have the impact that we need. And that's why we decided to do a summit at Kappa Alpha Psi's Fraternity Incorporated's grand chapter meeting. And it was very successful because they all partnered and spoke about it. The Grand Polmar group in Shelton, he had prostate cancer. I'm sorry, you just get emotional. But because he decided to disclose, which, you know, Black folks, we don't talk about it.
Don't talk about it. Don't talk about it.
So because he decided to disclose, I don't want to even tell you how many lives he saved.
That's
so
right.
By the time his chapter, half of them ran to see a doctor and some of them had advanced cancer. Suppose he had not taken that leadership role.
He
It's
saved some
real.
lives. He saved some.
It's
Now,
real.
listen, you know, the alphas listening and the Qs listening and the AKAs and the all whoopty whoops and skeety wheats. Everybody's listening. Zetas are listening. What can they do? What can organizations do or individuals to really help this movement? Because Roslyn, what you're doing is so unique and it's right there in front of your face. Once you enjoy the summit, you cannot deny the impact that not only it has had on you, but you feel a sense of responsibility of what can I do? And I think a lot of people know the issues, but just don't know what to do. What can we do to support you and the Black Health Matters Summit?
So what I would say is that we help build capacity for our revered fraternity, sororities, and civic organizations. So if you're having a grand chapter meeting or a boule, a major conference, call us. We're happy to help vet doctors and structure an educational program so that it's very authentic. We'll get you great experts and that we can have dialogue. I think first of it is to share and inform and build community. And so call us. We'll make it happen.
I think you said something there so important, and that is building community. I think that's what we seek as human beings more than anything else. And goodness knows if you're dealing with a health issue, like today as we are recording this, it's Caretakers Day. How many of us have had, whether we had the health issue, somebody in our family had the health issue. And so there is something very beautiful about knowing that you're not alone and having the resources and a community to help you not only survive in some cases, but to learn and to help others.
Well, we say knowledge is power, right?
That's right. And when you're prepared, you're no longer scared. That's what
right.
I tell my students. But you have been there. You had a health scare at one time. Did that make you have a little more energy behind this effort?
To be honest with you, I have to say that my own advocacy saved my own life.
Get out.
Some people are in careers and they don't practice what they preach.
Mm-hmm.
And I was adamant that what I was telling everyone else, I was going to follow myself. So yes, I am a 7-year survivor of ovarian cancer.
God bless you.
Thank you. It's one of those cancers that doesn't get diagnosed until you're definitely have advanced cancer, like stage 3, stage 4. It's definitely something that just doesn't present your OB is not going, your GYN is not necessarily going to pick it up. So it's of concern, and a lot of women don't make it. But I try to follow what we preach at Black Health Matters. It's become informed, advocate for yourself, and access the best possible care. In my situation, Black Health Matters hadn't taken off, right?
Right.
So I was an entrepreneur with empty pockets.
Oh, no.
But I still said I want the best care possible, because you know what? If I wanted those Gucci shoes, I'd have those Gucci shoes. If I wanted that Louis Vuitton bag, buddy,
be on that shoulder.
No problem. So I said, I'm gonna get the best care possible, and that's exactly what I went out and sought. And I got an amazing physician, surgeon, health ethicist that in the world, right? And when I was like, well, you know, this is all great. I am glad you decided that I can be your patient, but I ain't got no money. She's like, we have it here for you. There are grants. You don't know what these hospital centers, let me tell everyone, and I'm going to be very plain, the bigger the best of these medical centers will have a program that will be able to support all kinds of patients. I'm talking non-English speaking. I'm speaking immigrants. I'm speaking people with strained resources. Where there is a will, there's a way. She was able to find patient assistance. I plugged into it. I'm not going to tell you how much I paid, but you see, I'm here today.
You are here and doing well.
And I'm doing well. So don't be fearful. Like you said, be prepared, make your case. When you step out there, what do they say? The universe will conspire to uplift you.
No question. No question. And a lot of people know they aren't feeling well. They know there's something wrong. Their intuition, we're too intuitive not to know, but afraid of that bill. Yeah, I either got to feed my children or put them lights on or take care of this issue. And what you're saying is there are resources, but you've got to take the action. As my mama would say, God believes in matching grants. So you're going to have to help save your life, and he'll get the rest. He'll get the rest. I love Roslyn. I think we're around the same age. So I can really relate to us wanting our men folks to stay healthy. You know, I said our time, all the dating sites, and there's that our time for our age. I said, you know why they call it our time? What? I hope it's not because our time is almost up.
Oh, jeez.
So that's what we're combating today. No, but just really good stuff. Anything else that you want to talk about? Just maybe some surprises that you have seen in this time, or some real big wins that you've witnessed and experienced.
Well, let me talk to you about the upcoming summit, which will be held on November 13th. It's a full day virtual summit. And our win is that we have Dr. Anthony Fauci.
Wow. That's my man. I love me some Dr. Fauci.
Everybody loves him, right?
Love him.
And the beauty of that conversation is that the international president of the Links Incorporated will conduct that interview.
I was going to say, now, we can shout it out, everybody. Where the links? Where the moles?
Yeah. So she's going to conduct that interview. So
great. Who else do you have?
We have Vivica Fox.
My girl. Yes. That's my sister. Vivica and I shot a movie this summer that's going to be out in January on BET, y'all, by the way.
Oh, great. Yeah. Great. Yes. So, Black Health Matters wants to get in. We want to be able to let our followers and fans know about that. So
yeah, I sure will. But who else? Who else?
Yes. So we have Holly Robinson Peete.
Yes.
We're talking about autism. And the issue is, unfortunately, they say after a parent expresses concern, it's almost 3 years before they get that autism diagnosis.
Oh.
So this, and it's always better catch it early than
Catch it early. But that's a good thing, because maybe you just have your child checked just so. I mean, you never know. I mean, I know Holly and Rod have been such spearheads in this whole autistic awareness campaign, and they have been just stellar parents. I'm so proud of them. That's going to be a great conversation. I can't wait to hear Holly.
And again, for so many parents who are just frustrated,
there's
going to be an outlet for them.
Well, there's a community, like we were talking about. There's the community.
Yeah. And then we have Yvette Nicole Brown.
Oh, I love her too. I love everybody.
You know them all.
But you have a great lineup. These are wonderful folks. Okay, go on. Who else?
Yes. And so, let me just double back. I'm sorry, but Holly Robinson Peete is going to be interviewed by the president of the Jack and Jill.
Jack and Jill. Wonderful. What? Look at you got the Jack and Jills.
Mixing it up.
On it, Miss Roslyn.
There's a community for everything.
That's
and then
right.
again, Yvette Nicole Brown will talk about caregiving, and Renee Chenault will do that interview. So,
wonderful.
And we have a little bit for everyone. So, and the guru of apps is going to kick off with a great 30-minute workout. So if you want to know what all the fanfare is,
that's what I need to do. And this is all on Zoom.
Yeah. It's all at our platform, blackhealthmatters.com. Come register. It's free. It's fun. You'll win prizes. It's just a great day of health. We're committed. It's a movement. Be a part of it. This is a place in history that we can either continue to rise or just stay in terms of the status quo. And we're seeing that people are already getting somewhat fatigued, but let's not get fatigued. We have a ways to go until we have, cures for lupus, and there are diseases that impact African Americans most, sickle cell. So let's stay vigilant. Let's stay let's keep our advocacy, and we'll fight for cures. And also, please consider clinical trials. If that's an option for you, investigate it, and we'll see better outcomes in the future.
Yeah, I'm so proud of you. Keep up the good work. This is we end the podcast every time going, now go out there and do something good. You do that every time you leave the house, and we appreciate you so much. Please subscribe to Rolonda On Demand and share. Send out the link. Share it with friends. Leave a rating and review if you'd like. That'd be nice. Also, follow me in social media in all forms at Rolonda Watts. Remember, it's ROLONDAWATTS at Rolonda Watts. And follow me on Clubhouse in the Joys of Voice Acting Room, and also Reinvention Retreat, my other club there on Clubhouse. And for those of you interested in voice acting, my masterclass is coming up, and I would love to help you put that voice to work. So by all means, go to Rolonda.com, ROLONDA.com, and check out the details of the class. Let's set up a discovery call and let's get you enrolled, because we're setting sail soon.